Now let's go over the meat and potatoes of infection control, which is knowing all the necessary precautions. And obviously, in order to be successful in your NCLEX exam, you have to know this. And this includes the three main transmission-based precautions, which are contact precautions, droplet precautions, and airborne precautions. Okay, again, it's contact precautions, droplet precautions, and airborne precautions, right? And we all know this. Now let's start with contact precaution. Now it's pretty much self-explanatory in the sense that it is a transmission of usually skin-to-skin contact in regards with contact precaution. Now the major diseases that exist that enables the organism to be transferred through contact precaution that you will most likely encounter in your NCLEX exam would include mostly skin infections, since, as we all know, the skin is the number one barrier during a contact. Now, the skin infections would include diseases such as herpes simplex, impetigo, which is big in the NCLEX, scabies and staphylococcus, okay, and also varicella zoster. Now let's go ahead and take a look at droplet precautions, which can occur from a source such as a person during coughing or sneezing or even talking. Now, these droplets that contain the microorganisms can generally travel no more than 3 feet from a patient. That's why we as a nurse who is taking care of the patient must maintain a spatial distance of 3 feet. Okay, now back to droplet precaution. So what diseases can we usually see that involves droplet precautions? So these diseases can include diphtheria, streptococcal pharyngitis or tonsillitis. Certain pneumonias can also be transmitted through droplet precaution. Also, another important one is meningitis, especially if it's caused by the H. influenzae. Also, mumps, pertussis, and scarlet fever can all be transmitted through droplet precaution. Now, what is the main priority for us in taking care of the client? Well, we need to have the client have their own required private room, and we need to make sure that the door would be closed. And also, you as the nurse, like I mentioned before, that is taking care of the patient must maintain a spatial distance of about 3 feet. Now, you also need to wear a face mask, and this face mask must be worn upon entering the room. Okay? Now, lastly, let's continue on with the airborne precaution. Now, with airborne precaution, basically small droplets of infected pathogens, which are usually very small and tiny, will be suspended in the air over time and can travel over a distance of more than 3 feet. Now, there are four main diseases that can be transmitted through airborne precaution. Obviously, there are more, but these are the four main diseases that you will most likely encounter in your NCLEX exam. And that includes measles or rubiola, right? Now, as you remember, in nursing school, measles or rubiola can be transmitted through blood, urine, and also droplets, right? And it's remember that it's communicable after 4 to 5 days after the symptom of the rash. And as we all know, the treatments of measles can include bed rest and antibiotics, right? Now, let's go to the second main disease that can be transmitted through airborne, and that's chickenpox or varicella. And remember that when we assess our patient with chickenpox or varicella, our patient will usually have a slight fever, and they would usually also have a what we call a macular rash, which can eventually turn into a crust, right? Also, herpes or herpes zoster can be transmitted through airborne precaution. And lastly, the most important one is tuberculosis, right? And remember that when we have a patient that has tuberculosis, we need to make sure that we have the patient in a private room with a negative pressure. So basically, it's a negative pressurized room. And basically, what it does is that it enables a ventilation system that generates negative pressure to allow airflow within the room and not allow the pathogens to escape. Okay, and also we need to make sure obviously to wear our special mask, and this is a number one priority. We need to wear our special mask, which is the N95 mask, specifically for tuberculosis. Okay, now on the next few videos I will go over more of infection control and of course also prioritization, and we will look at the most common types of content that you might and will encounter in your NCLEX exam. Now, to see more of the reviews, just go to www.allnursingnotes.com and take advantage of all the NCLEX review contents from the website. And if you do appreciate what I have been doing with these NCLEX reviews, you can support me and at the same time invest in yourself to pass your NCLEX by checking out my audio NCLEX review and of course the NCLEX online review courses, which you will all find at www.allnursingnotes.com. So thank you so much, study hard, good luck, and God bless.